I'm Kelly Krohn, Rheumnow, and Jack Cush have asked me to talk about what things I've learned about bone. Although I'm a rheumatologist, I do about 95% metabolic bone disease. I work in a very large academic orthopedic practice. So the rheumatology meeting's always been a little slim on metabolic bone and osteoporosis. One of our colleagues, Oscar Gluck, many years ago became a strong advocate to get us more bone content at the ACR meeting. We lost Oscar about 14 years ago, but through his family, his friends, and the ACR, we now have an Oscar Gluck Memorial Lecture every year. So I attended today's Oscar Gluck Memorial Lecture. It was done by Dr. Rosen from Maine. Dr. Rosen is an endocrinology bone expert, a basic scientist, and what he understands better than anybody else I know is the role of fat cells, adipocytes. And what I've learned from Dr. Rosen over the days, and today I learned even more, that fat cells, adipocytes, have the potential to become osteoblasts or mature fat cells. And there are things that can change their trajectory, and there are some drugs that change their trajectory. For instance, pulsatile PTH pushes them to become osteoblast. On the flip side, they make a lot of rank ligands, so fat cells in the bone marrow are actually significantly impacted when we give the antibody to rank ligand known as denosumab. So what we learned from Dr. Rosen today was fat cells are really important. They're important in the genesis of osteoblast cells, and they're probably also very important to the response to our pharmacological treatment for people with osteoporosis. I would urge you to get online and review Dr. Rosen's lectures. Dr. Clifford Rosen, it was the Oscar Gluck Memorial Lecture, and I think you can learn a lot. I want to prompt a little bit about tomorrow. Tomorrow there's actually a couple of good sessions, and I'm going to cheat and use my phone. At 2:30 tomorrow afternoon, Ken Sag is talking on complications of osteoporosis therapy. I think this is really important so that we have a better understanding of up-to-date insights into how do we continue or stop treatment, etc. And then at 3:15 in the same session, Susan Ott from Seattle, who is just an expert bone biologist, she's talking about bone issues in complicated patients, which would describe about 80% of patients in a rheumatology office. So yes, there's lots of bone here. We'll do our best as a bone editorial team to post about it and give you daily updates. Thanks very much and enjoy your meeting at the ACR.